and one last thing to keep in mind on this. I mentioned at the outset, we talked about medical inflation being 15%. So whatever everybody has been paying this year for their premium, assume that it's going up 15% as it is for everybody else. And as I say, most businesses are then passing on greater copays, greater deductibles, so your real costs are going up 20 to 25%. What we are doing with this investment that we're making one more large investment, which is to eat the increase for 010. So we're going to keep everybody flat from 09 into 010, which is unheard of. But what we're doing,
God bless you.
Well, what we're doing, again, all under the guise of we're trying to, again, push people into personal responsibility for their health and their health care. We ask that, the only thing that we ask in return for that is to keep flat going into next year, meaning to not have the increase. So in essence, that's a raise. To not do that is that when the nurse calls, when you're being asked to go through this, you're getting ready to go to procedure, you've got to accept that resource. You've got to accept that coach. You can't ignore that. This is going to be somebody over the telephone that's got to be there to help you, but they're not prescient. They don't know you have appendicitis and that you're going in to get something done. So you have to make sure that whether it's that or you have a hospitalization stay or something is going on, if they're reaching out to you, you have to call. You have to take their call and talk to them. We want you to engage with this coach and use this resource.
I mean, if you have
that's
knowledge,
the only quid pro quo.
If you have knowledge yourself, I mean, let's say you're steeped in medical knowledge, or you've done some of your own research on Google or whatnot, and people do that. I think it's a valuable tool. If you have knowledge, you can share that with them. They're not going to overrule you. You can. It's kind of a dialogue. Dialogue. Not
it is
so
a
much
dialogue. Absolutely. So this is, but again, this is something that we're just not going to pull out of the thin air. We need to have that interaction with someone who's much more knowledgeable.
Right.
So we ask that you engage. That's really what it comes down to. Ultimately, you are the patient. You are responsible for your own health care. You will make the final decision.
You can ask questions of that coach too. I mean,
absolutely.
Yeah,
but we want you to engage, and that's what it's there for. These are very smart people. We shopped this hard. We interview them. We did all of our due diligence, and we're very impressed with the approach that they take. The thoughtfulness and the caring that they approach their clients, their patients with. And so again, I think it'll be a great experience for everybody, but we're making a long-term investment in everybody's health and well-being that going forward, long-term, that we think this is going to make our employee base a healthier and better educated consumer of health.
And nobody has to worry about it. This is private too. What your little nurse or your coach is going to talk to you about doesn't come out at the company Christmas party.
Absolutely. There are very,
make sure.
It's up to you.
Steve, it's a great question. There are very, very strict
a lot of people freak out about that.
HIPAA regulations. It's all government. It's federal government, and all of those things are followed to the T. And it's respectful, and it makes sure that, again, it takes into consideration everybody's privacy and everybody's right to that information. But again, what it really does is it takes a qualified healthcare professional and puts them in a position when you need it to insert and engage with you to provide that helping hand so you can ask better questions and get better treatment. That's what it's all about.
Well, I don't know how it's going to turn out. It sounds like it's the something that's not being done other places, but it beats going to the DMV for your health care.
Yes.
I will say that.
Heck, I'm making 30% and I got a private nurse. That's what I'm going to tell people. I like it.
There you go.
I like that a lot.
Spend it any way you want.
Lou Dickey, CEO of Cumulus, thanks for spending time with the regular guys here.
Thank you, Larry.